Let's zero in on independent interpretation of tests in the inpatient setting, an element we're seeing used excessively. But here's the concern. In many cases, the documentation simply does not support counting it. Remember, independent interpretation isn't just mentioning a result. It's the physician providing their own re-review and interpretation of the test, independent of the radiologists. If this is needed, then we should expect there is a reason this additional work is required. In other words, it must be medically indicated in the documentation, and not just because the chest X-ray was accessible. What we often find is that the formal report have already been created by a specialist, and far too often the physician is merely echoing the report. That's not independent interpretation. This becomes a teachable moment, and often providing an example helps. Given worsening respiratory status, review today's chest X-ray to assess for evolving consolidation. Findings support continuation of intravenous antibiotics. A statement that interprets, gives a reason, and provides patient impact. Direct documentation, smart auditing. Auditors creating real change.